Okay, so we are going to talk about first of the birth control methods. As we were talking about, first we are going to talk about the first method, that is the condom. The condom is real simple. It involves the penis and it doesn't let to the semen to go out because it has a barrier over here. It also prevents you from infections and diseases. Then we also have the vasectomy. In what consists the vasectomy? The vasectomy consists in cutting the vas deferens over here and separating them. What does it provoke? It doesn't. It provoke the avoiding the connection between the spermatozoids to run over here. This is reversible, but in not all the cases, because you also have the probability to stay infertile. And finally, we have the pills. The most common is to take testosterone. What does testosterone makes? It suppresses the luteinizing and follicle stimulating hormones, so the production of spermatozoids doesn't occur. This method doesn't prevent you from diseases. Neither the vasectomy. And finally, we have the spermicidal lubricant. This consists in the lubricant put between the vagina and the penis, and when the sperms go out, the spermaticidal kill the sperms. This doesn't also protect you from diseases. It isn't effective as the condom or the vasectomy. The first method is the salpingoclasia. It's a surgical procedure that permanently closes or blocks the fallopian tubes over here, preventing the sperm from reaching the egg to fertilize it. The efficiency is greater than 99%, but the problem is that it doesn't protect you from diseases. The second one is the copper youth. The copper youth is a T-shaped device that is put into the uterus over here, and it has to be put by a doctor or a nurse. When it is inserted correctly, it is more than 99% effective. But the problem also is that it doesn't protect you from diseases. Then is the implantable rod, and it is put into the arm. What does it do? It delivers hormones, and the hormones make the release of the prevents the release of the ovum. It also thickens the mucus of the cervix over here, and makes the lining of the uterus thinner to prevent the implantation of a fertilized ovum. And it occurs over it occurs over here. The anticonceptive pouch is commonly put into the back, and it prevents the pregnancy by releasing hormones into the bloodstream that prevents the ovaries from releasing an egg. It also thickens the cervical mucus and thus prevents the sperm from reaching the egg. The female condom is a piece of plastic that you put into the vagina, and this impedes the sperms enter to fertilize the eggs. Finally, we have the spermicidal lubricant. This lubricant is put into here between the penis and the vagina, and this kills the sperms when they get out from the penis.
Hi, my name is Eduardo One, and I'm going to talk about the 6 common STDs in the world and how they affect the reproductive male system and the reproductive female system. Well, the first STDs I'm going to talk about is the HIV or the human immunodeficiency virus, acquired by the immune deficiency syndrome, called ADS. Well, this is caused by the human immunodeficiency virus, which is spread through the unprotected sexual interactions with an infected person or through using a contaminated needle of inject drugs or medical situations. It can also be spread through the intravenous drug use and much less commonly blood products, needles, or other sharp instruments contaminated with the infected bloody fluids or blood. This virus have three stages: acute HIV, chronic HIV, and the ADS. The effects of this virus is that especially attack the immune system cell of the body. The next STDs is the chlamydia, and this is the most common reported STDs in the United States, and it spreads mostly by vaginal or anal sex, but you can get it through the oral sex. So sometimes you will notice an old discharge from your vagina or penis, or pain burning on when you pee, but only about 25% of women and 50% of men get the symptoms. Chlamydia is caused by a bacteria, so it's treated with antibiotics. Next one STDs is the gonorrhea. The gonorrhea is another common bacterial STD. People often get it with the chlamydia, and the symptoms are similar. You usually discharge from the vagina or penis, or pain or burning when you pee. Most men get the gonorrhea symptoms, but only 20% of the women do. The next STDs is the herpes. The herpes is a virus, so you can cure it, but you can take medications to manage it. Herpes is easy to catch. All it takes is skin to skin contact, including areas that condom doesn't cover. You're most contagious when you have blisters, but you don't need them to pass the virus along. And the final STDs I'm going to talk about is the HPV, the human papillomavirus. Nearly every sexually active person will have HPV at some point. It is the most common sexually transmitted infection in the United States. More than 40 types of HPV exist, can be spread sexually. You can get them through vaginal, anal, or oral sex. You can get them by skin to skin contact too. So in conclusion, most of these STDs I talk about are related because most of them attack to the immune systems, attacking cells or the red blood cells or the white blood cells. That's why you get fever and all that stuff. For final, as we know, they are virus or bacteria. So most of the commons you can untreat them and you are gonna have it for the rest of your life, or sometimes there's going to be a vaccine that's going to cure you. We have to prevent this because, as I said, it's attack your immune system that can give you bumps in your skin and burns in your reproductive systems. So just prevent yourself.